Casey, graduate of Bachelor of Science in Medical Technology, Batch 2000. And this is my best friend Stella, who graduated Bachelor of Science in Nursing, Batch 2010. For the past years of practicing our profession, we have witnessed the struggles of healthcare workers in the Philippines. And we ourselves have experienced these struggles, which push us to make life-changing decisions. I decided to work abroad, and as for Stella, she changed career to medical coding. Yes, we are one of the millions of overseas Filipino workers who chose not to stay, who did not pursue in serving our country, the Philippines. Maaaring sabihin ng iba na di kami makabayan. Pero bakit nga ba dumating kami sa puntong ganito? Bakit nga ba marami pa ring mga healthcare workers ang gustong lumabas ng bansa? Para mas maintindihan po kami, here are the common struggles of a Filipino healthcare worker working here in the Philippines. Low salary. On average, a nurse's yearly salary here in the Philippines is more or less equivalent to a starting monthly salary of a nurse in the US. Just think about that. Heavy workload. The current nurse-to-patient ratio can reach up to 1:40 in some hospitals. But according to the Department of Health, the ideal proportion of nurses to patients should be 1:12. Imagine that. Poor benefits. Most of the employers in the Philippines prefer to recruit employees on a contractual basis. LGUs, on the other hand, will hire healthcare workers on job orders because of financial constraints. After 4 tough years of study and rigorous preparation for board examinations, you will be given a below minimum wage rate, poor or no benefits at all, and deprived of employment security in your own country. Government bureaucracies. The recently passed CPD Act of 2016 requires professionals to earn a specific number of units before their licenses are renewed. Not only will it take the small spare time they have to attend to trainings, but sometimes they need to shoulder the training fees themselves because there is no clear ruling that requires companies to pay for their employees' trainings. Career growth. Foreign countries like the US, UK, and Canada offers more opportunities that allow healthcare workers to study and work all together. Such opportunities are less in the Philippines. With all the mentioned reasons, wala naman na sigurong kukontra if sabihin namin na Filipino healthcare workers are more appreciated and valued outside the country than here in the Philippines.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020.
Doctors, nurses, and healthcare workers have become the unwitting heroes of the COVID-19 pandemic.
For all the brave and selfless Filipinos working at the front lines to stop COVID-19, I have a simple message. Maraming salamat po sa inyong walang kupas, walang umpay na pananilbihan.
At last, the Philippines is recognizing the value of healthcare workers, though in a very tragic way. This pandemic worsened the situation of our healthcare workers. They have to wear PPE for extended period of hours with little or no break. They get infected and others die. And what's worse is if people see healthcare workers wearing scrub suits or white uniform, they were discriminated.
Ng mga tricycle. Sa Binangonan, Rizal, tumatanggi rin ang ilang apartment at dormitoryo kapag na lamang mga nurse ang titira. Ganito rin ang naranasan ng ilang taga Davao City na pinaalis ng kanilang dormitoryo at tinanggihan sa mga room for rent. Sa Cagayan de Oro City, bumababa raw ang mga pasahero sa jeep kapag may nakakatabing nurse o naka-scrub suit.
For those who are working outside the country, the situation is more painful. You've been away from your family for quite some time, and if unfortunately you got infected and died, the pain is unbearable.
amazing number of Filipinos work in our NHS and unsung heroes, like so many, but just want to give them a shout out. These are the immigrants currently saving people's lives, coming here and actually enriching our country and doing an amazing job. So thank you to all the Filipinos who are here doing all this amazing work, and to every other immigrant working in NHS.
The Philippines has the best healthcare workers in the world, and that's something to be proud of. Yan ang Pilipino, dumadaing sa hirap pero hindi nagrereklamo. Nagpapatuloy mag-alaga hanggat kaya, hanggat buhay. Dahil para sa amin, hindi lang ito trabaho o propesyon. Ito ay isang bokasyon. Called to serve not just the Filipino people, but everyone who needs care. To all the Filipino frontline healthcare workers, laban! Saan ka man sa mundo, sa Pilipinas o sa ibang bansa, pinagmamalaki ka namin, kabayan.